Hello and welcome back. I'm Barbara O'Neill, and today we're going to talk about sinus and respiratory problems. These issues can be incredibly frustrating and impact your daily life, but understanding the causes and remedies can make a big difference. In this lecture, we'll explore what triggers sinus and respiratory problems, common symptoms, and effective natural remedies to alleviate them. I'll also share some practical tips on how to support your respiratory health, so stay tuned as we dive into ways to help you breathe easier and feel better.
So where's my why? And there is always a reason. Why do these problems happen? Well, let me begin with the common cold. So in the 1940s in Salisbury, London, the Common Cold Research Unit was set up to find the cause and the cure of the common cold. They would get people, they'd put them in hot baths, then take them out and put them in the cold air. But they didn't get a cold. And then they'd get the people and they'd put them in a hot bath and they'd scrape the throat of someone that had a cold and put that in the person in the hot bath and then put them out in the cold air, and they didn't get a cold. In fact, after 40 years, they closed down in disgrace, really, because of a total inability to find the cause and the cure of the common cold. And they never will, because a cold is a house clean. It's just a house clean. And a friend of mine, his name's Gary Martin, he was the health director at Living Valley Springs Retreat in Australia for many years. He said that he found with a lot of cancer patients there were two common denominators. One, they never get colds. And two, they don't drink water. Now, when you're cleaning your car, what do you use? Water. When you're cleaning your dishes, water. The body, water. So because they weren't getting a regular house clean with daily water, and because they weren't getting regular colds, waste was building up in the body. And the waste build up in the body was a contributing factor to laying the groundwork of cancer. Interesting. So when you have a cold, you're blowing your nose, coughing up, what's all that? It's waste. It's the body getting rid of waste. I mentioned earlier in the week our lymphatic system. And our lymphatic system sweeps away waste from the tissues and it throws the waste into our respiratory. So the largest lymphatic organ is the tonsils, remember that? So I've been struggling with a little bit of a sore throat, so I've been having a lot of garlic and a lot of cayenne pepper, and I must do the running up and down the hills in the morning. Well, that hill near the gorge, you don't have to run. You just walk fast and you get high intensity. Oh, I was so excited this morning. I coughed up 4 lumps. Where's that coming from? It's from my tonsils. I know it's from my tonsils because I'm not coughing here. It's just coming from my throat. And so when I go home, I do oil pulling, which is coconut oil in the mouth, swishing around 10 times and then release it out, either in you call it a trash can, or you don't call it plug hole. Don't put it down the plug hole, the sink, you call it sink hole, because coconut oil, when it goes hard, what happens? Solid. Don't put it down the drain or you'll be in trouble. And often after that, there's a cough up, because what it's doing, the name's called oil pulling. It's coconut oil in the mouth and you swish and you're pulling waste from in the lungs, you're pulling waste from the tonsils, you're pulling waste from the sinuses, you're also pulling waste from the tongue, you're pulling waste from the glands under the tongue. Waste is being pulled from the blood vessels under the tongue. That's why it's called oil pulling. And Bruce Fife, F-I-F-E, he's written a whole book on it. One wonders how he could write a whole book on oil pulling, but he has. And he shows that just this simple thing, I've only known about it for about 10 years, but apparently it's been quite common all through Asia, is oil pulling as a simple little way of just pulling waste out of these areas. So if you have a cold, if you have a sinus, if you have any chest, a part of what you do to the body to bring about healing can be oil pulling. Now, because I travel a lot and sometimes I'm not breathing in the breast air, especially when I'm on planes a lot, I regularly oil pull. And I'm amazed when I oil pull that I'll often cough up a lump. And you know what I think? If I didn't oil pull, where would that lump stay? And if I didn't go up the big hills and down in the morning and I didn't cough up that lump, where would it stay? Well, I'd have to get more of a cold.
When you have a cold or any respiratory issue, oil pulling can be a beneficial practice. It helps to remove toxins and waste products that accumulate in the body. Oil pulling works by drawing out impurities from the tissues and organs, which then get expelled through the mouth. This method has been used for centuries in Ayurvedic medicine and is believed to support overall health by cleansing the body. In addition to oil pulling, maintaining a healthy diet and staying hydrated are crucial. Consuming plenty of fruits, vegetables and fluids helps to support the immune system and aids in recovery. Regular exercise and adequate rest also play important roles in maintaining respiratory health. By combining these practices with oil pulling, you can enhance your body's ability to heal and stay well.
But one of the reasons why people get excess mucus in the respiratory areas is because of an allergy. And that allergy could be to exposure to chemicals, it could be exposure to mold. Check your house. There can't be any mold in your house, it's a toxin. And it can also be an allergy to food. So it's a matter of putting the detective hat on and finding out, now, why do I have all this mucus? Now, if someone's got a cold, they're going to have mucus. And if someone had a cold and it went to the chest, they probably coughed for 3 weeks. That's usual. One lady said, my little one's been coughing for 2 weeks. I'll say, yeah, that's usual. That's usual. So let the body do its house clean. And rejoice every time a lump comes up. Where was it before it came up? It was in you. That's right. And so be cautious of exposure, especially if children are regularly getting tonsillitis, regularly getting colds. You've got to put the detective hat on. Maybe a cold or 2 a year. Children get a lot more colds than adults because that is boosting their immune system. And one of the best things you can get when you've got a cold is a fever. What did I call it? Best. When I trained as a nurse, fever was our enemy. But when you understand the human body and how it works, and look what a fever does, you begin to realize fever is actually your friend. And fever has a purpose. So rather than when something happens to the body looking for a drug, oh no, we don't do that anymore, a herb, something to stop it, look at why is it there? And how can we work with it to bring about healing? It's like one young man from Romania, he often dialogues with me. And his little one had a fever, so rushed straight to emergency. You know what I think? Why would you do that? All my children had fevers, but I never did because I thought, well, why is it there? And then it's usually because maybe they're teething, maybe they've got a cold. It has a purpose.
A fever is a natural response of the body to infection and is part of the immune system's defense mechanism. When you have a fever, your body raises its temperature to create an environment that is less hospitable for pathogens like viruses and bacteria. This elevated temperature can also enhance the efficiency of immune cells, helping them to respond more effectively to the infection. It's important to manage a fever appropriately, especially in children. While a mild fever can be beneficial, very high fevers or those that persist for an extended period may require medical attention. Over-the-counter medications such as acetaminophen or ibuprofen can be used to reduce fever and alleviate discomfort, but they should be used according to dosing guidelines and not excessively. In addition to medication, staying hydrated and resting are crucial. Fluids help prevent dehydration, which can occur with fever, and rest rest allows the body to focus energy on fighting the infection. If a fever is accompanied by other concerning symptoms such as severe headache, difficulty breathing, or persistent vomiting, seeking medical advice is essential.
And so the 5 main allergen foods are dairy, and that's one of the first symptoms of an intolerance to dairy is excess mucus. Excess mucus in the respiratory organs. Also the hybridized wheat, we've discussed that a couple of times. The hybridization of the wheat in the 1950s produced structures in that wheat that are not known in nature. And some people with a cast iron stomach who don't eat it, all day, every day, they don't appear to be many symptoms. But one of the symptoms of an allergy to wheat is excess mucus. Oats is high in a plant chemical called lectins. I think you call it oatmeal, call it oats in Australia. And lectins, if they get into the blood, they increase inflammation. So if someone has an allergy of any type, they're best eliminating the oats. Once the allergen's been, or the allergy symptoms have gone and everything's settled back to normal, maybe they can have a little bit. You'll quickly see. If they have the oats and then the mucus appears, what's the body saying? No, go to millet, go to rice, go to something else. Peanuts are commonly contaminated with mold, and so they're best kept away if there's an allergy. And refined sugar, basically it just is like kerosene on a fire with any sickness. So when I was at Misty Mountain a few years ago, we had a nurse who was an ear, nose and throat specialist nurse. So what she does, she assists the surgeons and the doctors that are treating sinus. So they do a lot of sinus operations to clear out the sinus. She said, you wouldn't believe the green slime that we pull out of sinuses. And she said, and every specialist acknowledge is that it's fungus. So then my question is, well, why is it there? And then I was reading, and I think I've quoted this in my book, that in the 1990s, a group of doctors in the Mayo Clinic declared through their research that sinus was fungus. So why is it there? That's what I want to know. Why is it there? Well, when you get someone that's got an allergy to these foods and there's common excess mucus building up in that area, then the microorganisms evolve into or change roles into a cleanup or cleanup team, you could call it. That's called yeast and fungus. That's what they do. They clean up the area. But because the allergens continue and the mucus continues, then the fungus, the yeast, have a continual food supply there. And so they go and get all of it cleaned out. And by the way, because they're having to breathe through their mouth, then the little canals at the back of their nose are getting smaller and smaller. And so then the next option is to have it drilled out. Yes, it's true, it does happen. And sometimes it's blocked up so much it bends, and it's called a deviated septum. Let me tell you about an experiment. Poor old monkeys, they've had a lot of experiment on them, but one doctor, he blocked up monkeys' noses for 6 months. And a group of monkeys, noses blocked up for 6 months. Their whole facial structure changed. Their jaws dropped down and they were miserable looking creatures. After 6 months, they unblocked the nose and taped the mouth up. I think they unblocked the mouth when they drank and ate, but most of the time, the whole structure changed again. But what they found with the blocking of the noses, so they weren't being used, the little canals at the back of the nose shrunk right up, and even skin grew across those little canals. So when they taped the mouth, so they had to breathe through their nose, it only took a couple of weeks and those little canals were open wide again. An illustration, if you don't use it, you lose it. And I have been stressing nose breathing this week, but the question then arises, well, why do people mouth breathe? People mouth breathe because their sinuses are blocked up. What's the next question? Why are they blocked up? Usually because of an allergy, because mucus is produced to protect those delicate linings of the nasal passages back of the throat. It's a protection. So what's it being protected against? Protected against allergens. So again, it could be mold in the air, it could be chemicals in the air, or it could be foods, and the foods are a common one.
Certain foods are more likely to trigger allergic reactions and cause mucus production. These include dairy, hybridized wheat, oats, peanuts, and refined sugar. Each of these foods can cause inflammation or allergic reactions that lead to mucus buildup in the respiratory system. Excess mucus is a common symptom and a protective response by the body to allergens. Dairy products can lead to an overproduction of mucus, particularly in people with dairy intolerance. The hybridization of wheat in the 1950s created new structures in wheat that some people's bodies cannot process, leading to excess mucus. Oats contain lectins, which can cause inflammation and allergic reactions. Peanuts are often contaminated with mold, making them a common allergen. Refined sugar exacerbates any sickness by acting like fuel to a fire, making symptoms worse. In addition to food allergens, environmental factors like mold and chemicals in the air can also contribute to mucus production. People with allergies to these substances often experience blocked sinuses, leading to mouth breathing. Mouth breathing can cause further problems such as the narrowing of nasal passages and the development of a deviated septum. Managing allergies involves identifying and avoiding triggers, whether they are foods or environmental factors. For some people, eliminating certain foods from their diet can significantly reduce mucus production and improve overall health. If mucus production and sinus blockage persist, medical interventions, such as sinus operations, may be necessary to clear out the mucus and open the nasal passages.
Nose breathing. I want to show you something else about nose breathing, and this can be particularly helpful for people who have breathing problems in the chest, particularly bronchitis or asthma. And I'll give you the story of this professor. This Professor Buteyko was a mechanic in the First World War. And he was a very clever mechanic in the Russian army. He knew engines, so he knew how to fix them. Doesn't that make sense? What's the good of having a mechanic fix your car if he doesn't even know how the engine works? And when he came out of the war, he analysed. He thought, if I knew how the body works, I think I could fix the body. So he went to train as a physician, a doctor. He became a professor. And he tells the story one night, because sometimes those poor doctors, they're on 24/7 call when they're training. So one night he looked in the mirror, or was the reflection of a door, and he was shocked at what he saw. He was overweight. His jaw was just hanging down. He looked terrible. He got a shock, stood up, closed his mouth, put his shoulders back. And that reflection was a confrontation to him. And so he started to breathe differently. He started to breathe only through his nose and not through his mouth, because the drop of the jaw shocked him. And he started to realise the importance of nose breathing. And he came across a man with an asthma attack one day, and he told the man to close his mouth. And he told the man to hold his breath. And within half an hour, the asthma attack had eased. So that's when he went to the drawing board. And that's when he discovered the wonders of carbon dioxide. Carbon dioxide, as I mentioned in an earlier talk, and we talked about it a bit yesterday, you need carbon dioxide to get oxygen. Remember, the 4 docking stations on the hemoglobin. 4 molecules of carbon dioxide are necessary to pick up 4 molecules of oxygen. 2 molecules of carbon dioxide, you're only going to get 2 molecules of oxygen. And remember, in the cell, if the cell's got oxygen, we've got 18 times more energy coming out of that cell. That when you nose breathe, you maintain correct carbon dioxide levels in your blood, enabling you to pick up oxygen. He discovered that carbon dioxide is a bronchodilator. So what's a bronchodilator? A bronchodilator is something that opens the bronchioles, which are those little, you've got your trachea and it splits into 2 lungs, goes down to smaller and smaller bronchioles. And what happens with asthma is they swell. So it's very hard for air to go in and out when someone is in an asthma attack. And so the drug usually of choice, well, it used to be, was Ventolin. And Ventolin is a bronchodilator. Ventolin opens the capillaries, or if it's quite serious, they'll put the person on a steroid, even a prednisone or cortisone puffer, and that gets the inflammation down, which opens the bronchioles, when really all the person has to do is hold their breath.
In addition to helping with asthma, nose breathing also benefits overall lung function and reduces the risk of respiratory infections. Breathing through the nose helps filter, warm and humidify the air before it enters the lungs, which mouth breathing does not do as effectively. Nose breathing can also improve sleep quality, reduce snoring, and even prevent sleep apnea in some cases. Another benefit is that it helps regulate blood pressure. By breathing slowly and deeply through the nose, the body activates the parasympathetic nervous system, promoting relaxation and lowering heart rate. This can reduce stress and anxiety levels. Additionally, training yourself to nose breathe during exercise can improve endurance by increasing oxygen efficiency and maintaining the balance of carbon dioxide and oxygen in the body. Thank you for joining me today to learn about sinus and respiratory problems. I hope the information and tips we covered will help you find relief and improve your respiratory health. If you have any questions or personal experiences to share, please leave a comment below. Don't forget to like this video, subscribe to the channel and hit the notification bell so you don't miss any future content. Take care of your health and I'll see you in the next video.